जी अस्सलाम वालेकुम। नहीं नहीं इनको करे। अस्सलाम वालेकुम।
वालेकुम अस्सलाम मैम, कैसी हैं आप?
अल्लाह का शुक्र है। सहर कुलसुम दो लोग तो हमें
वालेकुम मैम।
वालेकुम सलाम। अच्छी शक्लें दो तो दिख गई हमें, और भी दिखाएं अच्छा लगेगा। प्रेटी फेसेस। कुलसुम मास्क हटा लिया, साथ में कोई बैठा है?
मैम मैं भी नहा के आया हूँ।
जी मैम
अच्छा।
बैठे।
ओके ओके, आई एम सो सॉरी। चले चले। हम 2:45 बजे से सोचो लॉग इन किए हुए और आई वाज द ओनली वन। हमने कहा ये क्या हो रहा है। देन आई
सिर्फ
कॉल्ड
आप ही में थे, अकेले आप ही थे सिर्फ।
हम अकेले थे। पांडे जी भी थे। पांडे जी भी वहाँ सोच रहे होंगे कि हमें लगा गलत लिंक पे आ गए। फिर हमने
नहीं हम दूसरा करा रहे थे उस समय में, इसीलिए नहीं हो रहा।
अच्छा। चलो चलो, फिर लिंक ना थोड़े आउटसाइडर से भी किया है शेयर, तो पांडे जी कोई दिक्कत तो नहीं होगी ना ज्वाइन करने में?
नहीं कोई दिक्कत।
चलो ठीक है।
बस थोड़े से
फरगंदा भी है माशाल्लाह। कल्पना इज देयर। गुड।
थोड़े से और लोग ज्वाइन हो जाएं तो 3:15 पे स्टार्ट करते हैं।
हाँ अभी 5 मिनट हैं। थोड़े से और किसी को हम भी 1-2 लोगों को और मैसेज कर देते हैं।
सहर मैम अस्सलाम वालेकुम।
अस्सलाम वालेकुम मैम, कैसी हैं आप?
मैम अस्सलाम वालेकुम। अल्हम्दुलिल्लाह मैं ठीक हूँ, आप ठीक है?
जी, ऑल सेट।
अल्हम्दुलिल्लाह।
यास्मीन मैम ने ज्वाइन किया?
अभी नहीं शायद।
ये लो।
सहर कैन एम आई ऑडिबल टू यू बेटा?
जी जी मैम।
अच्छा यास्मीन मैम आ गए। हम ये कह रहे हैं कुछ एक्सरसाइजेस वगैरह भी सिखाएंगे ना?
नहीं मैं उसके लिए से करेंगे, उसके लिए से वर्कशॉप करेंगे हम लोग इवेंट सब की तरफ से।
अच्छा अभी टॉक होगी खाली। अच्छा
जी,
अभी टॉक होगी।
अभी थोड़े
अच्छा अभी किसी का मैसेज आया है तो हम बता देते हैं। ठीक है।
अच्छा, अगर कोई पर्टिकुलर क्वेरी होगी तो आई थिंक ड्यूरिंग द क्वेश्चन सेशन
ठीक
he can
I'll pass on.
हाँ,
अस्सलाम वालेकुम मैम।
it's more of an informative
श्योर मैम आप म्यूटेड हैं, आपकी आवाज नहीं पहुंची।
सर ये
क्या हुआ, नहीं मिली चाबी?
मैम अपने स्क्रीन को आप वो भी कीजिए। यास्मीन मैम अपनी स्क्रीन को आप वो कीजिए, आपका स्क्रीन इन्वर्टेड आ रहा है थोड़ा। जी।
अब हुआ?
हाँ हो गया। अब आप माशाल्लाह आवाज भी आ गई। अस्सलाम वालेकुम।
चलिए, वालेकुम अस्सलाम। इसी से कर दो, उसको बाहर रख दे दो, टेबल पे रख दे दो उसे, है ना।
अस्सलाम वालेकुम।
वालेकुम अस्सलाम।
अस्सलाम।
ओहो साइमा।
साइमा है।
जी देख रही हूँ।
सब खैरियत?
अल्हम्दुलिल्लाह।
बस अब ऑनलाइन मुलाकातें बहुत हो गई, अब आप आके गले मिलें।
हाँ,
गले,
सही
हाँ।
बात। अल्हम्दुलिल्लाह हालात खुशगवार हो गए अल्हम्दुलिल्लाह।
अब तो परमिशन मिल गई ना गले मिलने की 21 से।
जी बिल्कुल, ये रखी है यहाँ पे।
हाँ बस
जी
21 को एक गेट टुगेदर होना चाहिए बढ़िया सा।
बिल्कुल।
मैम आपके यहाँ से डीन सर ज्वाइन कर रहे हैं?
मैंने मैसेज तो किया था उनको, करना चाहिए। हाँ, अफशार साहब को भी कर दिया था, वीसी साहब को।
अभी 1 मिनट है, वैसे कर लेंगे शायद इंशाल्लाह।
इंशाल्लाह।
पिछले 2 मीटिंग्स में ना बहुत ज्यादा वो हो रहा था एको, पर अल्हम्दुलिल्लाह आज नहीं हो रहा है।
बेहतर है अल्हम्दुलिल्लाह।
हाँ काफी बेहतर है।
हाँ, जबकि हम सबके स्पीकर ऑन है।
हाँ नहीं वही हम कह रहे हैं माशाल्लाह से ना, उस दिन बड़ा इशू हो गया था।
चलिए पूरे टाइम ठीक रहे ये।
नहीं इंशाल्लाह ठीक रहेगा।
इंशाल्लाह।
जी।
Ma'am, with your permission, shall we start?
I think we have given time 3:20. So start exactly at 3:20.
Okay, ma'am.
बोले थे आपको स्किल लीजिए
Ma'am, may we start? Yasmin, ma'am, you're not audible.
Yes, you can start. Hello, Seher.
Yes, ma'am.
Yes, start please.
Okay. A very good afternoon, respected Honorable Vice Chancellor of Jammu Hamdard, Professor M. Afshar Alam, Chairperson, Women Development Cell, Professor Dr. Yasmin Shamsi, our respected resource person of the day, Dr. Sohrab Ahmed Khan, all deans, members of the Women Development Cell, our Deputy Dean, Student Welfare, Zinat Iqbal ma'am, all faculty members and students of Jamia Hamdard. Dean W. Ross very aptly said, clearly, the thing that is transforming is not the technology. It is the technology that is transforming you. As we are approaching towards digitalization, we are advancing technologically, but deteriorating health-wise. Technological upgradation in the last 2 decades has led to majority of the Indian population facing posture-related issues. There has been a transition from the mechanical world to computerized world. This pandemic has forced people to work from home, which has made them least physically active, and they are relying completely on digital media. Recent research postulates that working on laptop for long hours in an inappropriate posture can lead to various musculoskeletal problems, and those can be majorly dealt with physical therapy. Therefore, there is a need to create an awareness about what impact this digitalization has on women's health. So we are grateful that Sir has accepted our invitation and is going to share his views on this worthy topic. With this, I, Seher Zaidi, Assistant Professor, Department of Physiotherapy, Jamia Hamdard, feel privileged to extend my warm welcome to all present here for today's lecture on the topic Musculoskeletal Health Among Women During the Digital Era. चांद भी हैरान है, दरिया भी परेशानी में है. चांद भी हैरान है, दरिया भी परेशानी में है. अक्स किसका है कि इतनी रोशनी पानी में है. Our respected Professor Dr. Yasmin Shamsi, Chairperson, Women Development Cell, has always encouraged us with her visionary thoughts, and all of us are trying to work towards that common goal. She has always been the guiding light behind all our efforts. With those words, I request you, ma'am, to deliver the welcome address.
Thank you, Dr. Seher. Honorable Vice Chancellor, Professor Dr. M. Afshar Alam Sahab, Speaker of the Day, Dr. Sohrab Ahmed Khan, respected deans, heads of the departments, distinguished faculty members, and dear students, Assalamu alaikum, and a very good afternoon to all of you. I'm extremely pleased of awareness program on the women's health in digital time. In today's program, our key speaker is Dr. Sohrab Ahmed Khan, Associate Professor, Department of Rehabilitation Sciences, Jamia Hamdard, who would deliver a very informative lecture on the topic of musculoskeletal health among women during the digital era. This lecture has been organized to create awareness about the impact of excessive use of digital devices by women on their health. As all you know that, and as Dr. Seher has mentioned that, the technological upgradation in the last 2 decades has created a new environment, and there has been a transition from the mechanical world to the computerized world. This has resulted in multiple posture-related musculoskeletal problems among the masses. The current COVID-19 pandemic has forced people to work from home, which made them least physically active and to sit on their digital devices for a prolonged time. And as Dr. Seher mentioned, that recent researches have demonstrated that working on laptops, computers, and mobile phones, etc., for long hours in an appropriate posture may aggravate musculoskeletal problems, especially in women. Hence, there is a very good scope of physiotherapy and rehabilitation sciences to play their vital role in the prevention and redressal of such health problems. In today's talk, our honorable speaker, Dr. Sohrab Ahmed Khan, will throw light on the remedial measures for major musculoskeletal disorders, which are commonly seen in women due to the excessive working on various digital platforms. I feel that today's talk shall spread relevant information about the impact of excessive use of digitalization, and all the participants in this function would be benefited. I once again welcome you all and wish today's function a great success. Thank you.
Thank you, ma'am, for your encouraging words. शुक्रिया, सद शुक्रिया ए इल्म फन के ताजदार। शुक्रिया, सद शुक्रिया ए इल्म फन के ताजदार। आपकी आमद ने बख्शी है हमें इज्जो वकार। इल्म के जहदो अमल पर गर करें हम तबसरा। इल्म के जहदो अमल पर गर करें हम तबसरा। बिल यकीन सोहराब अहमद आप हैं एक शाहकार। Although Dr. Sohrab Ahmed Khan hardly needs an introduction, he is equally famous for his outstanding clinical skills and academic expertise among students as well as staff of Jamia Hamdard. But it is an absolute honor to introduce him formally to all of you. Dr. Sohrab Ahmed Khan has been currently working as an associate professor in the Department of Physiotherapy and a medical superintendent in the Rehabilitation Center. Sir has more than 15 years of teaching experience and more than 21 years of clinical experience. Sir is a member, Board of Studies for Department of Physiotherapy of the Integral University, Lucknow, Sharda University, Noida, and Deen Dayal Upadhyay University, Gorakhpur. He is also an external expert for syllabus revision in SGT University and a member draft committee of the scope of physiotherapy practice and development of ethical guidelines for physiotherapy clinicians, academicians, and researchers by the Delhi Council of Physiotherapy and Occupational Therapy. He has more than 35 publications in journals of national and international repute and is a recipient of various prestigious awards and recognitions. Sir is an excellent mentor and has a friendly approach with his students. Not all students have similar academic aptitude, but Sir believes in taking up each task as a challenge and involving all students to enhance their performance. Sir का मानना है, मेरे साथ चलने वाले तेरी जुस्तजू के सदक़े, मेरे साथ चलने वाले तेरी जुस्तजू के सदक़े, कहीं थक के रुक ना जाना मेरे साथ चलते चलते. With these words, I request Dr. Sohrab Ahmed Khan, Associate Professor in the Department of Physiotherapy, to enlighten us about the impact of digitalization on women's health and what preventive measures we can take.
So I will try to okay. Honorable Vice Chancellor Sir, respected Chairperson of Women Empowerment Punjabi Hamdard Jasmine Samsi Sir, ma'am, all the respected deans, head of department, our faculty members, and dear students. Today's topic of my lecture is very relevant for especially female, but males can also be benefited from this lecture because nowadays the whole world has changed from mechanical era to digital era, okay? And most of us are performing same kind of activity every day. So nowadays, if I met at least 10 people in a day, so I feel if their age is above 25, out of 10 people, at least 8 are having musculoskeletal problem, okay? Some may be aware about their problem, some may not be aware about the problem, okay? Because there is two things which can be helpful in roll out the diseases, that is sign and symptom. Symptoms comes very late and sign is not noticed by the person, okay? So the purpose of this lecture is we have to create some awareness among all of you. So you should be able to diagnose sign, you should be able to rule out your problem when the sign originates, when the sign comes, and should seek proper advice and make yourself from serious injuries in future, okay? The topic of presentation is musculoskeletal health among women during digital era. So what is musculoskeletal problem? The whole system, if you see, the musculoskeletal system is the biggest system of the body, okay? Around 80% of the body mass is made up of these musculoskeletal system, which include nerves, muscle, tendon, ligament, joint, cartilage, and spinal disc, okay? And these are the structure which make our body musculoskeletal system. And nowadays, if you go to the epidemiology of this system, you can go to the data. Musculoskeletal disorder are recognized as one of the most common occupational health hazard, okay? Whoever is working nowadays, they all are at risk of developing musculoskeletal problem, okay? And they are one of the most important cause of affecting our life, quality of life, okay? Because quality of life matter. If you are alive but you are not able to perform your role in society, you are not able to fulfill your requirement for family, society, etc., etc., you will not be called healthy, okay? So musculoskeletal health is going to play a very important role in creation and development of society. Current estimate as per Lancet 2012, back pain, only 332 million people are suffering from low back pain only, okay? 332 million people are suffering from neck pain. 250 million people are suffering from knee pain. And other musculoskeletal condition include around 560 million people around, okay? So you can, this is the data of 10 years back, okay? So every 10 years WHO release data, the new data will come 22, and the number may be double because in last 10 years, the digital use of computer, user technology has been increased many fold, okay? So if we will have data of now, we could find this data maybe 2 or 3 times more. So musculoskeletal problem is one of the biggest global burden as per the study in 2010, demonstrate the impact of musculoskeletal disease as the second greatest cause of the disability, okay? So this problem, musculoskeletal health, is causing second disability, second major cause of disability in the worldwide, okay? And many studies found women have more musculoskeletal morbidity than men in general population. There are a number of reasons why women are more sufferer. The data shows if we compare the musculoskeletal disorder among male and female, the data shows females are more sufferer of the musculoskeletal disorder. And because the reason may be women now they are contributing in each and every field of the growth and country. Apart from working, they are also playing their role at the home. So they are double burden, okay? This could be one of the important reason. And there are some other cultural issues we'll discuss, like we are considering that female should walk with the head down, and head down is going to affect your posture and it can cause cervical spondylitis, okay? Same as females are having more tendency of having fat around their back and thigh, and this could overburden their leg, which could develop osteoarthritis in future. So these are the few reasons how women may involve more of musculoskeletal disorder as compared to men. So first we will discuss what are those factors which are affecting musculoskeletal health of women during digital era. And the first and most important factor is inactivity. Inactivity means nowadays, because of digitalization, because of more advanced equipment, our mobility has been diminished. We are reduced. We are confined to a flat system. We are confined to a chair, okay? So because of this type of facility, our mobility has been decreased. So when there is a mobility decrease, we will be inactive, and especially in case of women, they are more ignorance. As male may spend more time outside, they can go for a walk, they can run, they can go for physical activities as compared to female, but females are ignorance about their physical activity, okay, as well as overprotection, okay. In our society, we are providing more protection to female. Female hai, bahar nahi jana hai. If they will go out, so what people will think about that? So because of overprotection behavior, females are not going out for those activities, okay. And third thing is self-isolation. Self-isolation means females are more and more family-oriented, children-oriented. They are more concerned about their family, so they are giving less emphasis. Therefore, less focus on their health, and all these factors leads to physical inactivity. And what happens when they will be physical inactivity? They will have sedentary life, and when they will have sedentary life, they will not use their musculoskeletal system properly, and movement of those system is mandatory for their survival, their nourishment, their removal of metabolites. All these can lead to systemic dysfunction, and when they will have pain, they will again have all these kind of musculoskeletal problem. So I will, with this diagram, you can see physical activity lead to deconditioning. Deconditioning means our body is conditioned as per my requirement of body. If I am running every day 5 kilometers, so I will not get tired after running 5 kilometers. But if someone is not running even a 1 kilometer, even a 5 meter of running may give her fatigue and injury. So our body can condition as per our body requirement. And because of physical inactivity, it can lead to deconditioning. And deconditioning may degenerate, deconditioning may atrophy many of the joint sensor, muscle sensor, and it can cause pain. And pain can lead to depression. Depression may lead to disability. And all these ultimately make a vicious cycle. Ultimately, people become more physically inactive, and the problem may aggravate more and more. So what is the solution? Solution means we have to be exercised regularly, okay? There is data from one research, only 3 in 10 school going students are spending 60 minutes every day. Only 3 in 10, yani ki 7 log, they are not spending 60 minutes of physical activity every day. I am talking about the school going children. Only 1 in 3 children are physically active each day. It means out of 3, only 1 children is physically active. 80% of the adults do not meet the guidelines for aerobic and muscle strength. There is a standard guidelines for the adult, children, and elderly to go for their physical conditioning, physical health care, but 80% of them are not following the guideline. Even they don't know what are the guidelines for remain healthy, physically healthy. Only 1 in 3 adults get the recommendable amount of physical activity each week activities. Less than 5% of the adult engage in 30 minutes or more than activity every day. These are the researches which are showing how people are inactive nowadays and how this data is increasing day by day. So if you exercise is having various benefits: reduce body fat, increase lifespan, oxygenate body, strengthen muscle, it can manage chronic pain, okay, reduce diabetes risk, strengthen heart, clear arteries, boost mood, okay. So there are n number of benefits of exercise, and if you exercise, it will maintain your mobility, it will improve your memory, it can improve your coordination, strengthen bone, improve complexion, detoxify body, decrease stress, okay, boost your immune system, lower blood pressure, reduce cancer risk. So you can see how many benefits, you can see the benefits of the exercise over here. The second factor is load capacity mismatch. This is one of the biggest factor nowadays. We are not conditioned, we are not, our body is not designed as per my job requirement, okay. So we should first of all, we should train our body, we should make our body fit and suitable for that job. Suppose if I am traveling more and more, my body should be more flexible, because nowadays we are not traveling from block car, we are traveling for a high velocity car bus, okay, where our body is in momentum. If your body will not have flexibility during the breaks, you will have a micro tear, and micro tear may lead to musculoskeletal problem in future, okay. So same as we are not having that level of endurance to perform any activity for 6 or 8 hours, okay. For those purpose we need aerobic capacity, okay, but our bodies not have that level of aerobic capacity, so we will have a fatigue, and fatigue can injure our musculoskeletal structure, okay. So the one of the important factor nowadays, load and capacity mismatch. My body capacity and my workload, my body load is not matching. So how can we solve this problem? Excessive load, how can it can cause problem? Excessive load on tissues leads to injury. Increased tissue ability to manage load with strength and conditioning. But you can see in the older age, people make 1 or 2 floor houses. So what they did, they go 1 feet, 2 feet down and start foundation from that. There's no use of iron bars, no use of concrete in the foundation, because they know they will not go more than 2 floor. But nowadays, when a builder is going to make a 10-story, 20-story building, he's going 4 floor down, and he's putting maximum iron bars and concrete to make a foundation strong, because he know he has to carry more load. So nowadays the principle is either you have to decrease your body load, or you have to build your body strength more and more to carry more body load, or to carry the more stress, to either prepare your body or because obesity, you can see obesity or overweight is not because of one reason. There is n number of reasons. Obesity could be because of genetics, you cannot change your parent. Obesity could be because of hormone, you could not control that hormone. Okay, so there is number of reasons for obesity. So beside controlling obesity, we should try to increase the body capacity to carry more load. Okay, same as we could not skip any of the work, because we are all are overloaded in this era of competition. Everybody has to perform more and more if you want to grow. So if you want to perform, you have to work more and more. So your body should be prepared to perform that level of work every day. The next problem nowadays among women is sitting disease. If you analyze your whole week activity, you will came to know you are spending around 15 hours per day in sitting position. Okay, whether it was eating, traveling, taking classes, preparing notes, whatever you are doing, you are maximally spending your time in sitting position. And when you are in sitting, your few muscles are remain in contracted position, few joints are remain in compressed position, and few muscle and ligaments are remain in stretched position. Okay, this can cause imbalance. Our body is working on a principle of balance. Okay, for example, suppose if there is a bamboo, if you want to make that bamboo erect, the ropes from which you are trying to stabilize the bamboo, should all side ropes should have an equal length and strength. If one of the rope will be having more strength or more, it will be shortened, what happens? The bamboo will be tilted to that side. Same as we are stand erect. Okay, human beings are standing erect. Okay, and their spine is not one bone, it is all around the spine, all 4 sides, and those muscles should have equal length and strength. But because of our sitting job, one muscle gets shortened and the other muscle get lengthened, and it is one of the commonest cause of problem nowadays. The quotation says nowadays sitting is more dangerous than the smoking. Okay, in this diagram you can see sitting can cause headache, it can cause neck pain, it can cause some chest pain. Okay, it can affect your breathing, it can increase risk of diabetes, it can cause risk of muscle degeneration, it can cause pelvic floor dysfunction. Okay, pelvic floor muscle is a very important muscle, we will discuss later. It is very important muscle among female. So prolonged sitting can also weaken your pelvic floor muscle. It can increase risk of carpal tunnel syndrome, it can increase risk of weight gain. So sitting is one of the disease package. If you are sitting for long, you are putting your body at great risk of developing not only musculoskeletal problem but other problem. Okay, so how to solve this problem, how to avoid, because we could not escape sitting, because our job doesn't allow us to escape sitting. So what should we do? Cut down on some of the activities which need sitting but which is not important for our life. We should try to avoid, like watching TVs. Okay, we could watch TV in lying position, we could walk and watch, okay, like video game. As well as we should engage ourselves in some of the outdoor activities at least 2 to 3 times in a week. Okay, we have to plan at any cost we will find some time for ourselves and we will go for outside activities. And 3 to 5 times a week you should go for the play. And every day you should go for morning walk. You should do some of the physical activity at your home, because nowadays we are very busy in our offices work. We are not giving any time to our housework. Even small work can make you engage in physical activities. Next is metabolic disease. Nowadays, India is going to become a diabetes capital in the world, okay? Diabetes, thyroidism and obesity. These three are metabolic disease and they are having direct impact on the musculoskeletal health. The example says, if your body weight increased by 1 kg, if your body weight increased by 1 kg than normal, your knee will have 4 times more stress. It means कि अगर आपका body weight normal weight से 1 kg बढ़ा तो आपके घुटने पे वजन 4 kg बढ़ जाएगा. So it is putting your knee joint at risk. Same as the other diseases like diabetes and hypothyroidism, they are having direct impact on the musculoskeletal system and nerve. And nerve and muscle both work together, and problem in one may leads to problem in the other. Because of the diabetes, the sugar level is more, blood is more concentrated. So to our body mechanism try to dilute the blood, and the water to dilute the blood comes from the muscle cell, the nerve cell, and ultimately the water of the muscle and nerve is decreased, and it can cause cell death of the muscle and nerve, and we will have a muscle atrophy and diabetic neuropathy. Okay, so how to combat with all this problem, how to reduce the risk of musculoskeletal disorder or other disorder with the risk of diabetes, hyperthyroidism, etc., etc. The solution is only and only one, that is you should be active, you should exercise. Okay, when you exercise, you can cut down the risk of complication because of diabetes, because of hypothyroidism, because of obesity. You should be active. So if you are active enough, if you're exercising regularly, if you're following the precaution, you can beat the complication because of diabetes, thyroidism, or obesity. Okay. Next, and nowadays, one of the also important factors is mental stress. Everyone is in mental stress nowadays, and we all know that our body is having around 5 liters of blood. Okay, and the main function of blood is the transporting organ. Blood is carrying all good things to the tissues and collecting their waste back and removing it to the kidney and lungs. Okay, so blood is nothing but a transporting system. So blood is carrying all good things, especially oxygen and nutrition. Okay, and blood is supplied to different tissues as per their demand, their importance. Like heart is having more important role, kidney is having more important role, brain is having more important role. So if important structure is on work, blood will be supplied more to that area. Okay, so blood supply is dependent upon the working capacity, working style of the structure. So if we are in mental stress, what happened? Because of mental stress, my brain, my mind is working more. So it may require more nutrition. So if brain is at work all time, it will utilize more and more blood. And if the amount of blood in body is fixed, so what happened? The other less important area will be supplied less blood. Upper limb, lower limb, they will be supplied less blood. So when we will remain in stress for a long time, what happened? Those structure may be in trouble, they will be weakened. Okay, and you will develop musculoskeletal disorder. So you can see over here how stress is going to affect your health. Stress is causing one of the important factor for cold and flu. Cancer may be because of stress, depression, eczema, post-traumatic stress disorder, stomach ulcer, heart disease, asthma, and musculoskeletal disorder. Okay, so all these diseases are directly or indirectly linked with the stress. What stress do with all these things? Elevate adrenaline and control level of depletes. It is causing, stress is causing inflammation, and inflammation is causing damage. Okay, so it makes a vicious cycle: more stress, more inflammation, more damage, more stress. So ultimately this is going to affect the overall health of the body. So how physical exercise is going to reduce your stress? Physical exercise is going to improve your mood and sleep. Okay, increase focus, you can increase concentration by exercise. Okay, help long-term memory, help in overcoping depression, reduce stress and anxiety. Okay, so these are the beneficial effect of exercise, how exercise is going to help in your mental health. Then one of the very important factor nowadays is poor posture. We all are aware about the posture, but we don't know how to sit, how to work, how to watch mobile phone, how to work on the computer. Okay, And with this, if you are seeing this diagram, you can see over here, a person is carrying mobile, watching mobile, and the head and neck angle is 0 degree. When the head and neck angle is 0 degree, you can see the neck is carrying only the load of 10 to 12 pound. It means the neck is only carrying 10 to 12 pound of the load, which is the load of the head. And as the person has bent his neck 15 degree only, the weight has been more than double. It is around 27 pound. It means only by 15 degree of neck flexion, my neck is carrying around more than the load of the head. At 30 degree, you can see the load has become 40 pound. At 45 degree, the load has become 49 pound. And at 60 degree, it has become 60 pound. Okay, it means only by bending my neck more and more, the load on the neck has increased around 5 times. Okay, so if my neck will carry 5 times more load than its capacity, what happened? It will degenerate early. That is the most common reason nowadays. Every youngster is having cervical pain. Everyone is having cervical spondylitis. Okay, earlier when we were students, we have been taught this disease is the disease of aging. It happens around 60s and 70s. But nowadays we are getting many youngsters in clinic whose age are 25 year, 20 year. Okay, and they are having cervical spondylitis, disc bulge. Okay, the second example I want to show you, you can see over here in different posture how disc is pressurized. A person is lying supine, the disc is carrying only 25% of the body load. When I'm lying side lying, what happened? The disc is carrying the load of 75%. Is erect standing having 100% load of the body. Okay, forward bending 150, bending with, okay, you can see forward bending something, all these are rescue position. Okay, so where your disc load is going to increase more than the 100%, they all will cause injury. And nowadays disc herniation, disc bulge is one of the commonest problem among females as well as those who are working on the computer or working in sitting position with forward bending posture. They all are at highest risk of developing disc bulge. Okay, and this is a progressive condition. Initially you will have only back pain, but if you will not take care of the back pain, the disc will compress the nerve more and more, and then you will have a pain in the whole lower limb. Then you will have a weakness, and sometime if the condition worsen, person can be paralyzed and he or she may lose bladder and bowel. Okay, so disc is very serious problem nowadays. The third diagram, you can see how to sit. If you see, if the hip and back angle is around 110 degree, the back is only having a load of 5%. And you see, when I am going to decrease the hip and neck angle at 100 degree, the load has become 15%. It is also acceptable. But if I am standing erect, it means my hip and back angle is around 90 degree. The load is around 40%. And if I am sitting in flexion position, when my angle is around 80 degree, you can see the load is going to increase by 90%. Okay, so you can see this diagram in the vertical column. When I am bending down and down, a disc is a cushion, disc is a gel filled bag. Okay, if I am bending forward, there is a pressure to the disc, and the gelatinous material of disc is coming back and compressing the nerve. Okay, and nowadays this is a very common problem among female involving disc bulge, and that is also called sciatica, etc. So how to correct posture? I have shown here some exercises and some precautionary guideline how to save our spine from the injury, how to sit on the desktop, how to carry bag. I have shown here various right and wrong position, what should be right and what should be wrong. I have also shown the diagram how to improve posture, and for improving posture you have to walk straight, you have to practice yoga and exercises, avoid crossing your legs while standing, sleep in your back, try swimming and maintain good posture. Same as in the other diagram, you can see over here, avoid forward bending, avoid lifting. Suppose if you are lifting something, don't bend your back. You have to bend your knee only. If you are working on computer, try to maintain your spine and hip angle around 100 or 110 degree. So by maintaining this position, you are not going to compress your disc and you will be saved from the disc bulge. One of the very common injuries nowadays is repetitive strain injury. What is repetitive strain injury? It means we are our muscle, ligament, tendon, they all are made up of minor thin filaments, okay, like a rope. If you see a rope, it is having very thin fiber and thousands of fiber collectively form a rope. Same as muscle, ligament, tendon, they all are also made up of a thin muscle fibril, okay. So what happened with every activity, which are odd activities, if my body is not prepared, if I'm not used to of that activity, if I'm doing any odd activity without proper warm-up, without proper stretching, I will meet with some of the microfibril injury, okay. I will lose 2, 3, 5, 10 fiber of my muscle, my ligament, my tendon, okay. And whenever I will have an injury in any of these structure, I will injure my muscle, my ligament, my tendon. So they all have capability of healing, but they could not heal by regeneration. They heal by repair. Repair means you are replacing the original tissue with the help of local tissues. Okay, local means less quality tissues. So we are losing collagen after injury, and which was replaced by fibrous tissues. Fibrous tissues are less elastic in nature. Okay, so when you are replacing your elastic tissues with the help of less elastic tissues, so with everyday injury, मान लो आज 5 के 5 टूट गए, next day 5 टूट गए, okay. So with every injury, you are losing extensibility and you become old. This is one of the common reason for the getting older and older. Because when a child born, he is having enough flexibility in his body, and the reason is that his body is having around 80 to 85% of water and 15% of solid. But when he grow older, with every injury, he is replacing collagen tissues with the help of fiber tissues, which are less elastic, having less water content, and our body become more rigid and stiff, okay. And we may get more and more injuries because of losing flexibility. So nowadays, most of the problem are because of repetitive strain injury. Patient is not coming to us, yesterday I went down and have injury. They are saying slowly the problem aggravate, and now the problem is out of control. Most of the patient coming to us, they are having gradual onset of the problem. It is a type of repetitive strain injury. So if we will follow proper guideline, if we are aware about this type of injury, so we can save our body from these injuries like neck pain, elbow pain, mid back pain, lower back pain, wrist pain, shoulder pain. These all are not one day problem. It is the repetitive strain injury which could appear after times. So how can we avoid these injuries? Maintaining good posture at work, taking regular break from the long we should not do any positioning, any activity of the body for a long time. We should frequently change the position. Suppose if I am working on my computer, so after every half hour I should take a 2-step, come back. Okay, it will give us a regeneration. Okay, so taking regular break from long and repetitive tasks, it's better to take smaller, more frequent break than one long lunch break. Okay, so आपको क्या करना है? You have to take frequent, small break between any activities. It could be after half hour, after 40 minutes. Okay, trying breathing exercise if you are stressed. Okay, breathing is the best exercise you can perform anywhere, anytime. This is the most simple form of exercise, and breathing is going to refresh your whole body. Take a stretch back multiple times throughout the body day. Okay, stretching is very important because I have told you nowadays our body don't have the strength because most of us are not involved in coolie type of work. Okay, we all are involved either in traveling or sitting and carrying our body load in a specific position for a long time. So we should have more flexibility. For example, if you are sitting all the day on the mattress and you sit on all the day on the hard wooden chair, you can feel the difference. If you will sit on the mattress, you will not have any discomfort. But if you sit on a hard wooden chair for even 1 hour, you may have pain. Same as if our body is flexible enough, so it can absorb your body weight without any discomfort. But if your body is stiff, rigid, tight, so what happened? It will give you pain and discomfort. Okay, so for making your body flexible, you should regularly stretching all the muscle regularly, as well as stay hydrated. Okay, because our flexibility, anything can become flexible only because of availability of more and more water on the body. So nowadays we are more busy in the work, we forget to take a sip of water. Okay, so we should keep water around us all the time So with every half hour, we should have a sip. So we should keep our body hydrated. Next problem, next factor is vitamin D deficiency. This is one of the biggest problem nowadays in metros. Not only women, children's and women's are a great sufferer of vitamin D deficiency. And the reason is that vitamin D is directly synthesized in our body. There is no diet, no special diet which could provide us vitamin D. The best source of vitamin D is which can be synthesized in our skin, and for the skin, the synthesis of vitamin D in the skin, the mandatory requirement is our skin should come in direct contact with the sun rays. Okay, if we are wearing a cloth, if we have applied some cream, lotion, oil, or I'm sitting in my car with the gloss off and taking sun bath, it will not help my skin to generate vitamin D. Okay, it means for synthesizing vitamin D in our body, my skin should come into direct contact with the sun rays without any cloth over there. And the guideline says at least 40% of the body should be exposed. Okay, 40% of the body should be exposed. Skin should into direct contact with the sun rays, which is not possible with especially our Indian female. Okay, they wear more cloth. Most of them are staying in flat system where there is no sun. Even they are working in office where there is AC but no sun rays. Okay, so this is one of the biggest problem nowadays because of it is causing vitamin D deficiency. And vitamin D deficiency is not only affecting your musculoskeletal health, but it is affecting your overall health. Like for example, sleep changes. If you are having deficiency in vitamin D, it could affect your sleep. It could worsen your mood. It may cause back pain. It may affect your appetite. It may give you early fatigue. Okay, you will have pain in skin and dark circles. You will have, okay, you are predisposed for skin infection as well as oral infection. You will have frequent cough and cold. You will have decreased muscle strength. You will have aching bone. Okay, so vitamin D deficiency is not only affecting your musculoskeletal health, but it is affecting your health overall. Okay, and the solution is very simple. You should expose your body minimum for 15 minutes every day, at least, by keeping your 40% body exposed to the sun rays. Okay, so what are the health benefits of vitamin D? It is good for healthy bone, intake reduce flu risk, reduce the diabetes risk. It can also prevent cancer. It helps in balance blood pressure. It helps in absorption of minerals. It helps in pregnancy and healthy bone. In healthy infant, it can give you a gift for healthy pregnancy. It helps in losing weight. It helps in body to fight depression. Okay, these are the benefits of vitamin D and how easy to get body. How easily we can get vitamin D? Only spending 15 minutes by keeping our body exposed at least 40% for 15 minutes only. Okay, so these are the, and with exposure of sun as well as exercise is also mandatory. Only by exposing your body in sun rays is not sufficient for the strengthening of muscle and bone. Okay, you should have a, like you have a material but you don't have a laborer and masons, you will not be able to make a building. Same as vitamin D will act as a material, but exercise is that expert mason who is going to build the bone and muscle. Okay, so if you are combining vitamin D as well as exercise, it is going to have your healthy bone and more muscle, stronger muscle. Okay, next factor is poor ergonomics. What is ergonomics? Ergonomics means the working environment, the chair where I'm sitting, the desk where I'm keeping my laptop, the way of keeping laptop, how my infrastructure is supporting me, jahan main kaam kar raha hu, how they are designed. Are they designed as per my body? Suppose if I'm a teacher, I'm teaching on blackboard, okay, and the height, my height is small and the height of blackboard is up, so I will always stretch my body to write something on that. And the other teacher who is tall and the blackboard maybe at lower level. Okay, so what happened? He has to bend down to write something on that. So we should try to adjust our infrastructure. Jahan pe hame kaam karna hai, it should be as per my body require, body type. Okay, so what is ergonomics? Ergonomics mean our workplace should be as per my body requirement. Okay, so there are 4 factors: personal factors and workplace. Personal factor means genetic factor. Anthropometric factor means your body lambi hai, choti hai. And if you go to a classroom, I have visited many schools and I have given advice to them. In a single classroom, few kids are obese, few are very lean and thin, but they all being provided with the same kind of sitting desk and chair. Okay, so one child may be fitted properly, but the other may not be able to fit in that chair. Okay, so we should think about all these things. We should provide, especially not if you're not able to provide all these things to children because they are more flexible, but at least in office space, we should provide proper ergonomic advice to each and every staff to maintain his health or her health. Okay, so ergonomics is going to play important role in the prevention and development of the musculoskeletal problem. So how can we help them? We have to eliminate the risk. We have to find out the risk causing factor. Suppose if I'm seeing one of my colleague is sitting wrong, or his placement of chair is wrong, his placement of laptop is wrong, I may teach her or him how to keep your laptop, how to use laptop. Right? So we can eliminate the risk of developing musculoskeletal disorder. Equipment change, we can change the cloth, we can change the desk, we can change the chair, we can change the laptop, we can change the keyboard as per the requirement of the persons. Okay, then job rotation. Sometime, especially in offices, if one person is doing monotonous work, it means he is performing same kind of activity every day, so it will lead to overuse of one structure and underuse of the other structure, which may create imbalance in future. So if there is job rotation, if job rotation is possible in a work environment, so we have to keep the job changing. So everybody should get exposure of different kind of job. So he or she will use different kind of activity. So he could save herself from development of musculoskeletal disorder. Then regular training is very mandatory. Okay. Time to time we have to create awareness about the ergonomics, about the posture, so we could provide the development of musculoskeletal disorder. Next is pregnancy, because every woman has to go through these phases. Okay, and pregnancy is a condition where your whole body is going to have a lot of internal and external changes. Okay, so internal changes are hormone and external changes are body posture and body mechanism. Okay, because there is sudden curve changes in your body which could shift the center of gravity of your body, and ultimately it could put a stress. And the second thing is hormonal changes, especially in the third trimester. A hormone known as relaxin hormone is released among female. The role of that relaxin is to loosen the all ligament, bone, capsule, all should be loosened, so the baby should not feel pressure. Okay, so the purpose of that hormone is that all structure around the baby should be flexible enough, loosen enough, so baby should not feel any pressure. So after delivery, the lady has to resume her work, but it cannot strengthen those loosened ligament in 1 or 2 days. It takes at least 6 weeks. So if you go to the older era, not in digital era, every lady was given at least 6 weeks of complete bed rest after delivery. And even after delivering 6 to 7 babies, normal average baby delivered in the 30 years before era, every lady was delivering 6 to 7 babies, and they remain active throughout the life. They could perform all the activities of household work, even they may be working in the field without any complaint of low back pain, neck pain, knee pain. Okay, but nowadays we see a lady after first delivery, she may have low back pain, neck pain, knee pain, and the reason is that the lady who has to get at least 6 weeks of complete bed rest with proper massage of those tissues, which may resume its strength again, is not possible. Because of nuclear family, everyone is involved in the child care from the day of delivery. Okay, and they are carrying weight on those tissues, and the ligament muscle which has been loosened remain loosened, and ultimately the load comes on the joint and joint start degenerating. Okay, so next thing is postural changes, body changes, hormonal changes. And if you are going to a physiotherapist, he or she will take care of your prepartum care and postpartum care. If you are consulting a physiotherapist before delivery as well as after delivery, you can be saved from various complications which could happen during pregnancy, especially musculoskeletal. And there are 2 other problems which are mainly common among multigravida. One is urinary incontinence and one is prolapse uterus. Okay, urinary incontinence is condition where because of loosen or weakened pelvic floor muscle, the lady is not able to hold her urine, and sometimes when she sneezes, when there is a cough, there is a history of leakage of urine. Okay, and this is a very social problem. Most of the female doesn't report it to the doctor, and if they report to the doctor in earlier stage, okay, it can be easily managed with the help of some exercises and physiotherapy. But if it advanced, the condition has become worsened, the surgery is required to control those problems, and the success rate of surgery is not very impressive. Okay, there are more risk of complication. So these two, one is urinary incontinence and second one is the prolapse uterus, where the uterus tries to come out. Okay, and it could be also managed with the help of physiotherapy, but because it is also social problem, most of ladies are not reporting to the therapist, and when the condition has become worsened, ultimate option is surgery. And in this diagram I have shown some diagram what are the common exercises for a pregnant lady during pregnancy as well as after pregnancy, and I have also shown over here what is the physical activity recommendation for a lady after childbirth. Then these are the factors, how these factors can affect the musculoskeletal health and other health aspect of the female in this digital era. The next one is the role of physiotherapy, how physiotherapy can help those ladies. Okay, first of all is prevention. How can we prevent the development of this musculoskeletal disorder among women? First, I have already discussed, but here I want to conclude. First is education. Most of the things we are not knowing, and we are performing wrong activities, wrong posture, and because we are not aware about the right posture. Okay, so even by only education, how to sit, how to walk, how to work, how to use computer, how to use mobile, if we could educate the lady, we can save many complication, many development of muscular disease. Okay, second is ergonomics, I have discussed already. Postural awareness, muscle performance training mean we are going to prepare your body muscle as per your job requirement. We are assessing your overall activity of the day, and then we will train your body, your muscle as per your body requirement. Next is the balance training. Is a very common issue nowadays. Most of us are not involved in the physical activities and exercise, so we all are having less balance. So balance training can nourish your joint as well as other structure. So we are very expert in balance training as well as pre and post partum care. Okay, all the lady who is going through this family process, they must seek help from a physiotherapy during pregnancy period as well as postpartum, yani ki after delivery. Whoever will seek the help from physiotherapist, they will be saved herself from the development of many complications of pregnancy as well as musculoskeletal problem after delivery. Okay, as well as we are also helping in joint alignment and lubrication. Okay, joint is having a outer layer of joint is cartilage. Okay, cartilage is avascular tissue, but if you are applying proper loading on the joint, cartilage may get nourishment through the joint lubrication mechanism. Okay, so with the help of proper exercise, we can maintain the joint lubrication, and if the joint lubrication is maintained, we can prevent any joint from development of arthritis. The main cause of arthritis is impaired lubrication of joint cartilage. Okay, so with the help of proper physiotherapy advice, we can maintain the joint lubrication, thereby we could prevent the development of arthritis in future. Second thing, after prevention, we are also providing intervention. What is intervention we can provide? Optimizing the healing of injured structure. If there is some injury, I have told you some structure can heal by repair. It means repairing by poor quality, but with the help of physiotherapy and different modality, we could increase the quality of healing. Quality of healing in terms of flexibility, in terms of time. So we can improve the quality of healing with the help of some modalities, some exercises, some manual therapy technique. If we could not be able to optimally heal that structure, because we know if the structure has been injured, some structure could not achieve its 100% as original because they are replaced by poor quality tissues. So if we are knowing that this structure cannot achieve its 100% of previous, so what can we do? We should try to produce some compensation. For example, suppose a person got injury in knee, and we know after this injury, the knee of that person will not be able to achieve the 100% strength and flexibility as earlier. So what I will try to do, I will try to strengthen her ankle and hip, one proximal joint and one distal joint. For example, suppose if I want to secure 80% mark in a class and I have 4 subjects, so if I got 60 marks in 2 subjects, I will try to achieve 100 marks in other 2 subjects, so my average marks will be 80%. Same as if my one joint got weaker because of any injury and I could not be able to heal those structure completely because of some delayed reporting of patient, because of some negligence. So what can physiotherapist do? Physiotherapy can over strengthen the either contralateral part, or one proximal and one distal joint can be over strengthened, then we can compensate that loss of one joint. Even if we fail to provide compensation, the third option with us is provide support. If some structure has become weaker, so if you will if you will keep using of the structure, what happened? It will damage early. Okay, so what could we provide? We provide some support, some external support to weaker joint, so we could save the further damage of that joint. Okay, and in some time we could decrease the loading. For example, you have seen in the some diagram, when I am holding my mobile with neck straight, my neck is carrying only 10-pound load. Okay, and if I'm bending neck, my neck is carrying 60-pound load. So we could analyze some activity which are going to put excessive load. For example, suppose if I am standing only, my knee is carrying only 100% load. If I am walking, my knee will carry 200% of body load. If I am running, my knee will carry 400 times of body load. Okay, so with the help of increasing pace, the loading on the joint is going to be increased. So if I feel that my patient joint has become weaker, so I will try to avoid all those activities which could increase loading on that weaker structure. And in some person, if we feel that this type of loading will further cause damage, we are going to cease or modify the activity. Suppose if a patient came to me and saying, when I am washing cloth in sitting position, I am having more back pain. So I will think how I could modify the washing of that lady, so she should be able to wash the cloth, as well as she should not have more pain in the back. Okay, so sometimes we modify the activity and sometimes we cease the activity. And when should we modify and when should we cease? If we feel this activity is patient is doing for her personal thing, so I should ask patient to stop. But if that activity is a patient's social responsibility, suppose if a lady is cooking for her children, I could not stop her cooking. But if someone is cooking for herself, I would say, bahar kha lijiye khana hotel pe, no need to cooking because it may aggravate your problem. So we could prevent through ergonomics, we have discussed. We could prevent through education and flexibility training. Flexibility training is another important factor nowadays in digital era, because nowadays we are mainly either sitting or traveling in a high velocity vehicle. Okay, in both time we need more and more flexibility to prevent our body from injury, to prevent our body from repetitive strain injury. So flexibility is the key of health, musculoskeletal health nowadays, and we have shown different exercises over here how we can improve flexibility, as well as we have also discussed over here what are the impact of good posture and what is the impact of bad posture. You can see over bad posture could lead to low back pain, shoulder pain, neck pain, frequent headache, TM joint dysfunction. TM joint means your jaw, bone osteophyte. There are n number of factors which could, bad posture could cause a lot of problem in your body. And if you only correct the posture, I have mentioned over here how good posture is going to a lot of health benefit. Okay, so flexibility is the key, good posture is the key. And how can we maintain the flexibility and good posture? With the help of exercises, electrotherapeutic modalities, and manual therapy. And sometimes we need orthotics, sometimes we do's and don'ts. We can give us some guideline to patient कि आपको किस problem में क्या करना है, क्या नहीं करना है. So I have shown here some example like do's and don'ts for neck pain. Do maintain good posture, do keep your shoulder down and up, back. Okay, same as do's and don'ts in knee pain. I have also discussed do's and don'ts in back pain. So especially in spine, you should always avoid forward flexion. Okay, avoid lifting something by bending your back. If you want to lift something, don't bend your spine, bend your knee and lift something. Okay, If you are carrying something, don't carry the object away from your body. Try to keep the object closer to your body. When you keep the object closer to your body, it means your if weight arm will be lesser. We all are aware about the principle of liver. In principle of liver says, if your weight arm is bigger than the effort arm, you have to apply more effort for performing that activity. So what can we do? We can decrease the weight arm. Weight arm means the distance of the weight from your axis of rotation. Okay. So if we will keep the object closer to our weight arm, so closer to our body, so we will be easily able to carry that load. So in this PPT, I have shown how to follow do's and don'ts to avoid back pain, neck pain, knee pain. Okay. And with the help of all do's and don'ts, we can help patient, we can educate patient to prevent from musculoskeletal disorder. Finally, I will try to give you some key home message. Musculoskeletal disorders are among the leading type of work injuries, responsible for most of the loss of work days than any other injuries. There is no medicine to cure, but physiotherapy can effectively prevent, manage, and these disorders. Okay, pain is not a disease. If you are having any discomfort because of musculoskeletal disorder, you must seek help. Okay, if you will take painkiller, it means you are hindering your problem. Pain was giving you signal something's going wrong, and you are killing your informer. So don't try to treat the pain. First, visit the physician or physiotherapist to find out the reason for pain. And if the pain is because of involvement of visceral structure, vital structure, you will be referred to the physician. And if the pain is because of pain or any problem is because of involvement of musculoskeletal structure, the best doctor is physiotherapist, who could manage your problem, who could prevent the worsening of the problem. Signs are unnoticed and symptoms appear very late. Okay, we all are having signs nowadays. What is sign which could be diagnosed by doctor or physician? Okay, so nowadays we feel pain symptom comes when the condition has become worsened. Okay, so it is always advisable for all of us, whoever is working in sitting position, using digital ergonomic, who using computer, laptop, mobile, etc. We should at least visit to a physiotherapist at least one time in 3 months, and screen our body whether we are having any sign of musculoskeletal disorder or not. Okay, if we are visiting at least once in 3 months, I can guarantee you will be saved your body from many of the musculoskeletal disorder. Exercise is the best medicine, but it must be prescribed or supervised. Okay, don't do exercise by your own self, like yoga. Why yoga is harmful? Why I'm saying yoga? Because people are watching yoga on YouTube and performing. The difference between yoga and physiotherapy is that he is speaking English by reading Rapidex speaking course and speaking English by going through the whole procedure. कि आपने पूरा जो है grammar पढ़ी, vocabulary पढ़ा, meaning पढ़ी, फिर आप English बोल रहे हैं और आप yoga. So yoga is performing asanas. Okay, if your body is having balance and if you are performing asanas, you may have injuries. Okay, first assess your body, screen it whether all are balanced, normal. Then perform asanas. Okay, exercise must be prescribed as per the requirement of body and occupation. One person may have back pain. Suppose I have got 4 persons, all may have back pain, but I may prescribe 4 different exercises for all 4 patients, because it will be depend upon the assessment, their body requirement as well as occupation. So it means exercise should not be done by your own self. You must seek expert advice as per your requirement on your occupation. Muscle is the core in managing musculoskeletal disorder. Okay, in exercise, basically we are working on the muscle to improve the flexibility, endurance, strength of the muscle, and as per WHO recommendation, regular physical activity, at least 150 minutes of moderate intensity physical activity per week for adult. Every adult should assure that at least she should go for 150 minutes of physical activity of moderate intensity. You should not go for weight training. आप walking करिए, jogging करिए, cycling करिए, swimming करिए, but at least you should spend at least 150 minutes every week if you want to remain healthy, if you want to take care of your musculoskeletal health. Regular screening of musculoskeletal health is necessary. I have told you that sign comes early, symptom appears very late, and when symptoms appear, sometimes it is difficult to manage the condition because cartilage are one-time form tissues, and if it degenerate, there is no cure of cartilage degeneration in physiotherapy, in Unani, in homeopathy, even in surgery. Nobody can regenerate cartilage except they can replace your joint, replace your structure. Okay, so it is better, should rule out, keep the problem start. If after every 3 months, if you are screening your body, you will be saved from many of the musculoskeletal disorder. Frequently change the posture to ease the constant structure. Take short break from chair during office. Suppose if I'm sitting on chair, so my thigh is compressed, okay, and you know the blood in the body is coming because of pressure gradient. Artery is having high pressure and muscle is the receiver having less pressure. But if you press your muscle for a long time, muscle will increase the pressure, so it will not be able to receive sufficient amount of blood from the artery, and ultimately you may all have felt whenever you are sitting for a long time, you may feel tingling and numbness in the whole limb. It is because of the poor blood supply, because of increased pressure in the muscle, increased pressure in the nerve or muscle will not be able to receive proper blood supply. And then every structure doesn't have tongue. God has given us only one tongue, okay? The other structure has been given pain. दर्द हर स्ट्रक्चर की जबान है, दर्द जो हर टिश्यू की जबान है. तो अल्लाह ताला ने जबान खाली एक दी है, लेकिन दर्द के फॉर्म में हर चीज को जबान दे दी. So we should listen to the tongue of every structure, and even we should try to screen our body whether there is any possibility of sign or not. Work station must be ergonomically designed and promote good posture. It means we should also seek advice, help from the physiotherapist. If I am sitting here for 8 hours, 6 hours, whether I am sitting rightly or wrongly, my chair is right or wrong, my desk is right or wrong, my laptop, my gadgets are right or wrong. So we should take proper advice from the expert. Excessive mental work lead to deficient blood supply in the other part of the body. It means I have discussed it. If you are using more blood to brain, because brain is the superior of the body, so if brain require blood, other area will be having less blood supply. So we should try to relax our body. We should try to avoid stress. Balance between body potential and work requirement is key to healthy life. Okay. Yeah, you can see over here, pain is the body, your way of telling you something I have discussed, and prevention is better than cure. So if you will try to prevent, you should prevent the development of disorder. एक बार बीमारी हो गई, उसको मैनेज करना मुश्किल है, महंगा भी है, मुश्किल भी है, पेनफुल भी है. So it is always better to prevent development of disorder, and for those purpose, screening and awareness is best. Okay. And this was the WHO recommendation, which has already discussed. Take walking breaks, hit step goals of 10,000 per day. Stretch your leg 30 to 40 minutes per day. Use stand up 60 standing burns of 60 calories. If you are standing and stretching, you are burning. Okay, stretching hai, walking hai, at least maintain a target of walking 10,000 steps per day. Okay. Thank you so much.
Thank you so much, sir, for the informative lecture. And I'm sure all of us are going to benefit from the facts which have been discussed during this lecture. So if there are any questions from the participants, you may unmute yourself, and sir would be glad to answer your queries.
Just a minute. Dr. Sorab.
जी मैम.
It was a wonderful, informative lecture, and you presented very well. And since all of us are so free and frank to ask any such kind of problems to you, you have been really very helpful. I just have one question, that after the age of 42 or rather 45, the rigorous exercise, will it be harmful for the female? Or I mean, just the for how long the female should exercise? I mean, what is your suggestion about it?
Ma'am, normally regress mean there are two kind of exercise. Okay, one is for strength training and one for endurance and one for flexibility. Okay, as per your profession, you must have more endurance and flexibility. Okay, because you are spending more time on sitting on chair, you are involved in researches. Okay, so you don't need strength, you need more and more aerobic exercise. Okay, it means simple walk. Okay, and stretching is more than enough for you. Okay, and as per WHO recommendation, 150 minutes of physical activity, which is light impact. Okay, not cycling could be option, swimming could be option. Okay, even walking is good for you. Walking followed by stretching. There are some muscles in our body which we remain kept in the shortened position. Like if I am bending my elbow like this, so the front muscle has become shortened. So I have to stretch it regularly. Like I bend my knee all the day. So when I'm getting up, I should get up and stretch my body. So when I kept my muscle in shortened position for a long time, I should give it regular stretch. So they should be able to expand because muscle is elastic structure. If you keep it in shortened position, it will become shortened. If you stretch it, it will become stretch. Okay, you have to keep it moving. And ultimate purpose of muscle is contraction and relaxation. Okay, both are required for muscle.
Absolutely. And Dr. Saurabh, there's one more thing. Will cycling be able to reduce belly fat also, because it invites many problems, health problems.
Yeah.
Like we have, like for a female who has the tendency to gain weight. So even if this, I mean, cycling is going to help to reduce the belly fat and just reduce if the back pain has initiated because of the increase in belly fat.
Cycling will not help much to reduce belly fat, but it will help you to reduce your thigh fat. Okay.
Okay.
For cycling, for belly fat, you have to go for cross trainer. Okay.
Pardon?
Cross trainer.
Okay.
Cross trainer will help you. Okay, because when you're sitting on cycle, you are using only lower limb. There is no use of tummy. Okay. You have to load on your tummy. Okay. And secondly, in females, belly is not because of fat. In female, belly is because of the loose abdominal muscle. The muscle become loose, and so the content push it out and belly comes out. Okay. So if you want to strengthen your belly, you have to work on the strengthening of the back abdominal muscle. Okay. There is no much fat. It is only because of the weaker abdominal muscle.
Abdominal muscle.
The abdominal strengthening, it will be automatically going. Okay. It is muscle.
Thanks a lot, Dr. Saurabh. Thanks a lot.
Welcome, ma'am. Thank you, ma'am. Any other question?
Are there any other questions from the participants?
I have a small question.
Yes,
ma'am. Please go ahead.
Shall I?
Yeah,
yes,
sure.
please.
Okay, Assalamu alaikum. Good afternoon, a wonderful presentation, and I did not miss even a minute. I must tell you that.
Thank you. Thank
So,
you.
Saurabh sir, हम बस ये पूछना चाह रहे थे आपसे कि is it advisable to keep a backrest or a cushion? Because most of our chairs and between us there is a gap, and which normally is like you slouch because of that. So, what do you advise?
Yes, ma'am. There should be backrest. There should be backrest. But ma'am, the backrest available in market is only small size, large size, XL and double XL. Okay. And if you see the back of 100 people, okay, you will find everyone is having different back. Okay. So it means that is not whatever is available in market is not suited you. Okay. It should be tailor-made. When you sit on a chair, you should consult a physiotherapist, and they will advise you how to fill the gap between your body and the chair. It's okay. It should not be the custom design available in market. Okay, that is not suitable. That will harm you. Okay, ma'am.
Then I'll approach you, sir. I will approach you then.
Sure, ma'am. Sure.
And what about using this soft cushions which we use on sofas and all?
Yes, ma'am. It is better. Always better. Because ma'am, when you are using cushion, okay, every action has an equal and opposite reaction.
Absolutely.
But using cushion, it will absorb your load. Okay, it will act as a shocker. If you sit on the hard surface, it will give you equal energy will come with you.
Okay. ठीक है, I'll approach you inshallah. Thank you so much.
Thank you so much, sir, for your informative lecture, and it is always pleasure listening to you.
Thank you.
And but my question is that most of the females they complain of the back pain, and throughout their lifetime, no woman must have said that they are not having any back pain.
Yes,
so, but my question is that what are those red flags or the signs for which a woman should be aware that now it is the time to get the treatment of this symptom?
Ma'am, even pain is a red flag, okay? Why should we bear pain, okay? Pain is the first sign, okay? And if we ignore pain, it could worsen the condition. And spine is very important structure. Spine is very important structure. All the contents are coming to the lower limb, and during even हम कहते हैं young age में हाथ और old age में पैर बहुत जरूरी है. And all the nerves going to lower limb is coming from the spine, especially lower spine, okay? And the pain in back is indicating there is something going wrong in the whole spinal column. You have to rule out it. Otherwise, if you ignore the pain, in future, it will cause serious problem. Like if you could have radiculopathy, you could have paralysis, you could have major symptom. So it is always better to address the, I have told you, prevention is better than cure. So as soon as you got any sign of symptom of back pain, immediately try to find out the cause, because there are n number of causes of low back pain. Okay. We have to rule out as early as possible so we could prevent the progression or worsening. Okay.
Okay, thank you.
We should not wait for the red flag, man. We should not wait for the red flag. As soon as we got any symptom, we should go to the therapist as well as physician. Also, we should try to find out, because gynecological cause back pain का है, prostate cause back pain का है, kidney भी back pain का cause है, disc भी back pain का cause है, stenosis भी है. So we have to rule out it as early as possible, because if you delay it, condition can become chronic and more damaging.
Okay, thank you, sir.
Ma'am, pain should not be ignored. As soon as you got pain, visit it. Okay.
Thank you, sir. Are there any other questions from the participants? If any of the students would like to ask anything? Okay. I think this brings us to the end of this session. Thank you so much, sir. Now, I'd just like to announce the results for the essay competition we had organized. So, the Women Development Cell Jamia Hamdard had organized an online essay writing competition on the topic Vision of Hakim Abdul Hamid for Women Empowerment on 10th January 2022. We received 21 entries from students of different schools of Jamia Hamdard, and the essays were evaluated on the basis of content, relevance, language, and creativity. Before announcing the results, I would like to congratulate all the participants for their enthusiasm and for their outstanding work, which they have done. Indeed, it was difficult to choose the best one amongst the entries we had received. So I would like all of you to give a big round of applause to the winner of the first position, that is Javed Alam from BUMS third year. He has won the first prize. And
if he's there, then he should just put on his video.
Yeah, if Javed, if you are there from BUMS third year, Sumer. Second prize goes to Sophia Mishkat Khan from BPT second year, School of Nursing Sciences and Allied Health.
Very good.
And the third prize goes to Lubna Abedin from Department of Pharmacognosy. She's a PhD student.
Yes, very good. Nice to know. Nice
Congratulations, Lubna.
Lubna, आप हो क्या? Are you there, Lubna?
Yes,
So happy. Good.
Thank you.
Great. So we have 3 winners from different schools. Really glad that there was good representation from all schools.
That's wonderful. And Sahar, I must compliment you for the beautiful way you have conducted the whole show. And Saurabh sir, I'm really jealous. The type of praiseworthy she was saying. So I'm so tempted that someday you should introduce me also. Thank you so much, darling. Wonderful, mashallah.
All the participants and winners, they may collect their certificates of appreciation from the Women Development Cell Chairperson's office, which is on the first floor Unani department. And this is how, with mutual cooperation and with skillful approach together as a team, we will achieve greater heights. As we proceed towards the end of the program, I request Dr. Kulsoom Jan, Assistant Professor, SIST, Member WDC, to kindly deliver the vote of thanks.
Thank you, Dr. Seher. Honorable Vice Chancellor, Jamia Hamdard, Professor of Shah Alam Sir, esteemed Chairperson, Women Development Cell, Jamia Hamdard, Professor Yasmin Shamsi, respected Speaker, Dr. Sorab Ahmed Khan, all respected deans and deputy dean, our most valued participants and dear colleagues, a very good afternoon to all of you. It's my privilege to have been asked to propose a vote of thanks on this occasion. I, Kulsum Jan, on behalf of Women Development Cell, Jamia Hamdard, and on my own behalf, extend a very sincere vote of thanks to our Honorable Vice Chancellor, Professor of Shah Alam Sir, for allowing us to organize such events, for the encouragement indeed. We have been very fortunate to have with us Dr. Sorab Ahmed Khan. Thank you very much, sir, for joining us and for gracing your important information and sharing your opinions with us. I truly mention our deep sense of appreciation for you, sir, for your explanations on musculoskeletal health among women during the digital era. I wish to express my gratitude to our chairperson, Women Development Cell, Professor Yasmin Shamsi, for motivating us to organize such lectures. Thank you very much, ma'am, for the support and encouragement. I would also like to extend my sincere and special thanks to the organizing team for their unflinching support and encouragement and coordination. Thank you. At last but not the least, I like to acknowledge the presence of our participants for being with us and being a wonderful participation. So with these warm words, might I request Dr. Seher to please wrap up the session. Over to you, ma'am.
Thank you, ma'am. Thank you, everyone, for joining in. Thank you so much for your time. Thank you, Zeenat, ma'am. Thank you,
Thanks, Jasmine ma'am and team. Wonderful job, mashallah.
And I want to thank to the team of Computer Center. Whole
Yes,
team.
definitely.
Thank you so much for the whole team of the Computer Center.
They are the real backbones. There's no doubts and questions.
Absolutely. Thank you.
Thank you, ma'am.